Hello there. Yes. Are you here for an annual checkup? Lovely. Please do have a seat and relax. How are you doing today? Good. Now, I know your general physician is not here. At the moment, they are currently on vacation, so I, Dr. Athena, I'm taking over the Seashore Hospital and Clinic. It's a pleasure to meet you. Truly. I hope you feel safe in my care. Okay? Now, so, how have you been since your last general checkup, annual checkup appointment? Okay. And we've noted from your prior checkup that you used to experience insomnia and perhaps a bit of a difficult time falling asleep. Would you say that's similar to last time, or have things changed? Okay. It's good to hear, even if it's a little bit of improvement. Improvement is always improvement. And have you had your skin checked out since last time? Looking for moles or abrasions that look a bit different or uncomfortable? Perhaps a mole with a boundary that is beyond a circle. Okay, I'm going to be looking for that today, especially during the summertime, sunshine, which can get right to your skin. And overall, would you be okay if I touched your face and checked your heartbeat? Lovely. So, let's get on to the examination, your annual checkup. Thank you. So, it can be a bit cold. Just going to warm that up a bit. Now, going to place this on the neck here, and then right on the chest. So, just going to quickly place that. Lovely. Okay, the other side. Just don't move. Okay, and then right on the collarbone. So, just right there. Okay. So, a bit of an elevated heartbeat, but that's always because of nerves. Understandable. Now, I'm going to quickly grab your temperature if that's okay. We always use reusable thermometers, so if I could just pop that right underneath the teeth here. Just sit still, okay, and relax. And okay, you're surfacing at the normal temperature. Just going to quickly write that down. A couple questions. Have you been partaking in a lot of drinking or smoking recently? Okay. So heartbeat a bit fast, and general appearance and health looking good. Okay, so drinking and smoking not an issue. About how many alcoholic beverages would you say you could consume in a week if you do that test? Okay. And smoking, not just cigarettes? Okay, thank you. Being honest helps me get the best checkup of your health. Now, I'm going to do a quick eye look. I'm going to be looking at the arrangement of your eyes to see if it reacts to light. So, in each eye, 3 quick flashes. Then I'm going to get my otoscope and look into your ears. So, very quickly, just going to 1, 2, 3. Not too difficult, correct? Lovely. On to the other eye. Just a quick flash of light. 1, 2, and 3. Okay. Your eyes dilated well, about to 6 or 7 millimeters, excuse me, so that's perfect. Have you had any problems with vision? I'm just going to give a quick look up close here to each eye. Have you had any difficulties looking into your vision or something of the sort? Okay. And I forgot, do you wear glasses or contacts? Okay, that's good to know. It does seem that you have a bit of looks like a bit of a rash next to this eye, so I'll take care of that. In the meantime, it looks good for now. And back to the pen light. I'm just going to gently pull down the eye. I'm going to do one at a time. And I would like it if you could just keep your gaze on me, okay? Yes. So, it's going to quickly look very particular. Okay. And to the other side. Now just a quick pop of the light. Just very particular. Okay, lovely. Now to take the otoscope and look into your ears. So just try not to move a bit. Okay, normal build-up of wax and no inflammation in the eardrum or ear canal. Great, to the other side. And just taking a look, popping the light, and just assessing what I do see. So, again, normal look at the ear, general ear canal, and less wax. Okay, it's normal. Have you had any problems with your hearing recently, or perhaps heard any ringing in the ears? Okay, it's good to know, as that could also be something that we need to watch, but as you are good, that is perfect. Now I'm just going to pop my gloves on and I'm going to be doing a quick skin exam through the face, the shoulders and the scalp. Have you had a sunburn recently? Okay. And if you have wear, typically it's on the shoulders or the nose, high points of the face. Okay, I'll be looking. So I'm going to do a very precise look of your skin, just general. Have you had experiences with skin problems, skin types of diseases in your family or prior to your health record? particularly on the nose. How it points up the cheek, then we're going to look through the hair. So just quickly taking a quick look. Okay, now very precisely going through the bottom parts of the chin, looking for abnormal moles or irregularities, texture on the skin. Okay, now through the top of the head, just very carefully, just going to just each little precise bit of hair. And just looking. And I see nothing through the hair and not much through the shoulders. Just going to grab a bit of a magnifier for a quick little mole I do see on the face, just to double check with your health. It does have irregular form around the circle of the mole, so I'd just like to get a deeper look at that. Okay. And it doesn't appear to be at all a problem, just a mole that might be growing a bit. I'll have to check back in on that in a little bit. Now I'm going to get a tongue depressor here and we're going to just take a peek at the health of your mouth. So, if you would allow me to, could you please just quickly open your mouth? Thank you. I'm just going to take a quick look. Just a quick look here. You do seem to be having inflamed tonsils. Do you have any allergies or perhaps allergic to a type of food or allergen? Not that you know of, okay. Well, I'm going to be taking a quick sample of that and sending it to a laboratory. Just don't move, please. Just going to take a little sample off of the side of the cheek and to the side of the other. Okay, I'm going to send that in. Do you feel any sort of perhaps a soreness or? Okay, I do notice that. Now just taking another look. Yeah, I'm going to keep that noted. Thank you. You can relax again. And when the nurse saw you, did she check your abdominals to see if you had any stomach problems? Yeah, that's typically what they do. So I'm now going to focus more so on the face, especially down at the neck where I did feel inflammation. I'm going to be doing something called pressure and movement. Just going to gently touch around the face, and if you feel any sort of discomfort, please let me know, okay? Thank you. So just going to go around the eyes first. Okay. You alright? Okay, just going to test a muscle there. Wonderful, now here. Okay, now to the side. Okay, now we're going to feel just around the neck to see if potentially your immune system could be fighting something. did she let you know if there was anything abnormal? Okay, so irritation to the throat and irritation in the tonsils, sending in laboratory results. Check back in. Okay. Now that that's done, we're now going to go on to reflexes and to test the face, shoulders and arms and hands. And I'm going to test your knee. And I do have a bit of a tool. I'm going to use this tool to just gently tap on areas that should have a response, okay? It's not going to be at all painful, but if it does feel very uncomfortable, let me know, okay? Thank you. So first around the temples, I'm looking for a response right down there, so just going to... Lovely. Lovely. Now to each jaw side. Lovely. Okay. Now to the top of the lip. Good. Now to the hands. If you do pinch at the palm, your fingers will tend to move along with it. So if I may see each hand. Lovely. And okay, perfect. That was great. Now, again for muscles and reflex, I would like it if you could look at me, okay? And with your peripheral vision, let me know what numbers I hold on from each side of my hand. I'm going to stick to your visual field for this. So, if you see a number, just say it. Lovely. So, keep looking at me, use your peripherals. So, good. Wonderful. Now, if you have any extra questions or concerns, please let me know. Otherwise, this checkup has been successful. Going back on your results, you did have, again, the inflammation in the throat, swollen tonsils, and reflexes were good. That's lovely. But there could be potential virus as you had resulted in that. If it feels any more painful in a matter of a day or two, please call us back, because we would like to know how your health is to take care of you. As for the insomnia and the problem sleeping, I do have a specialist I can send you to get checked out. Would that be okay? Yes. And we will have your test results back in a matter of a day or two, depending on how the laboratory is right now. So overall, your health seemed to be in wonderful, marvelous condition, but the overlying problems that we did see could just be insomnia and a potential virus that could be going on, or perhaps allergens that you hadn't had prior that you now have in your older state. As well, you do appear to be looking in good health. Nothing seems to be irregular, such as a droopy eyelid or perhaps an arm that looks a little bit irregular. So, thank you so much for coming in. I know I'm not your regular doctor, but that's okay. I have written a prescription for you for a test to see a sleep therapy or some sort of a sleep analysis type of situation with a doctor that I highly recommend. And if you just go to the desk before you leave, just pick it up right at the table. It'll have your name on it. Okay? Now, we'll send you back the results, and if it is something that we need to triple check, we'll send you back in, okay? Lovely. Again, pleasure to meet you. You have such a lovely day and a lovely evening. And please take care of your health. Ciao.